Health. What a blessing when you have it, a challenge when you don't. The health of our community is a central place in decision-making, but a one-size-fits-all thinking overlooks some important differences. And sometimes health systems don't know what they don't know. As the head of the BC Women's Hospital Foundation, our next guest reminds us that understanding differences needs to be part of making a healthy society. Please welcome Janessa Greening.
We as women, we have a complex relationship with our health. When I was 9 years old, my mother was 29 at the time, and she was admitted to a psychiatric hospital and heavily medicated. My memory of visiting her is still etched in my mind, sitting on her bed in her hospital gown, looking forlorn and barely present, aching to be with both me and my sisters and her husband. The Canadian Institutes for Health Research tells us that women suffer the greatest burdens of disease and disability. They're more likely to suffer depression, stress overload, chronic conditions, injuries and death resulting from family violence. Although women live longer than men, women have a greater lifetime risk of functional disability, chronic illness, including cancer, cardiovascular disease, dementia, and a need for long-term care. And yet, we as women are often the principal caregivers to our children, our spouses, the elderly, and disabled relatives. On average, a woman cares for her spouse for 5 years at the end of her husband's life and then goes on to live an average of 8 years without the same type of intensive personal care. Safe to say, women give more than they get when it comes to their health. When my mother came home from the hospital a few weeks later, she began to disappear from our day-to-day lives, spending more and more time in bed. Eventually, hours turned into days, and days turned into weeks. She would spend on average 20+ hours a day sleeping. At one point, she didn't leave our house for a 7-month stretch. 70% of patients with medically unexplained symptoms are women. These are often used synonymously with terms that imply psychogenic cause. However, patients labeled with medically unexplained symptoms actually have yet to be diagnosed diseases, like an autoimmune disease that can mean lasting disability and even death. 70% of the people impacted by chronic pain are also women, but are typically treated less aggressively than men. Studies have found that doctors are more likely to diagnose a woman's pain as psychological. They're inclined to give them sedatives, antidepressants, and refer them to a psychiatrist, while men who present with the same symptoms are more likely to be given pain medication and referred to a pain clinic. Women get prescribed less pain medication than men after identical procedures. As a matter of fact, a study recently came out that showed that this bias actually starts in childhood. When a boy has open heart surgery, he'll be prescribed pain medication. When a girl has open heart surgery, she'll be prescribed Tylenol. The prevalence of mental health issues during the various stages of life stages experienced by a woman adds to this complexity of care and treatment. Yet most mental health research and therapy is based on a man's experience. Women experience depression twice as often as men, and yet are 3 times more likely than men to experience barriers in accessing mental health care. My mother was told she was tired because she had 3 small children, that she should find ways to reduce her level of stress. They gave her more medication. No one suggested her symptoms were serious or real, and no one sent her for tests. 1 in 10 women have been diagnosed with endometriosis. It takes on average up to 10 years to get that diagnosis, and many actually don't. It's debilitating. It impacts a woman's ability to work, to participate, to even have children. The number of women who have endometriosis equals the total number of people who have liver disease. Men are actually twice as likely to have liver disease. We have 30,000 pages of published research on liver disease and 1,800 on endometriosis. 2 out of 3 women in BC have reported feeling bias from a healthcare practitioner due to their gender. There are many entrenched and systemic reasons women are not receiving equitable access to quality health care. The suggestion we're more fragile, we are more prone to stress and anxiety, never experience hormonal stasis, carry greater societal burdens, more likely to experience violence, live in poverty, and lead single-parent households. Prior to 1998, women were not included in most research studies in Canada. And to this day, we're still largely excluded. Yet women experience 50 to 75% of drug reactions, adverse drug reactions. Yet medications prescribed to women have often only been tested on men, including aspirin and warfarin. Even within the field of health research, we see a pervasiveness of bias that continues to impact the health outcomes of women. Male researchers get funded more often, with higher grants, and are far less likely to research women's health issues. Female researchers are less likely to get sustainable funding, so studies are often not completed or don't make it to knowledge translation and implementation into policy and practice. Studies that should include equal representation of gender don't. And many final analysis do not have gender and sex analysis applied, so we still don't even know if the women within the trial reacted differently than the men. My mother eventually gave up on going to the doctor for anything more than prescription refills and checkups. She found ways to cope. She came at each day with a hope she might be able to work for a few hours, maybe make dinner, perhaps attend one of our school events. Never all in one day or 1 week. But she did what she could when she could, yet the months turned into years. We could simply say that one of the primary reasons we as women experience bias in the healthcare system and in the healthcare that we receive is, and why are we often sicker for longer, and why we don't get substantial answers as to what is happening with our bodies, is actually quite simple. We don't know what we don't know. Without the research, doctors are not equipped. Without the research, the unique healthcare needs of women is not validated. Without the research, women are unable to live a life to the fullest, participate in our economy and in our communities, be present for the people they love, and they'll continue to feel misunderstood and dismissed, and are suffering and dying unnecessarily. We have a responsibility to change the tide on women's health, to make the investment in the research, to insist that women are included, understood, believed, treated, validated, and healed. My mother eventually found herself with a new doctor. She described her situation. He sent her for blood work. My mother had thyroid disease, an autoimmune disease predominantly found in women. For years, she had that condition. It causes exhaustion, fatigue, weight gain, among many other symptoms, and left untreated, it causes mental decline, heart disease, and decreased lung function. A few years later, after I moved away from home and started my career, she received another diagnosis of ME, or chronic fatigue syndrome. ME is a chronic complex disease like fibromyalgia and chronic Lyme disease, and 3% of our population have one of these conditions, or 1.1 million Canadians, 79% of which are women. And yet the Canadian Institutes for Health Research has only funded 4 grants across all 3 conditions in 19 years. Gender plays a role in how healthy our society is. It plays a role in what kind of health care you received. It played a role in my mother being absent from my life and the lives of my sister and father for over a decade. When I took on this role, I didn't realize that my own story would show up in the stories I would hear. I didn't realize that what had happened to me and my family is happening every day. And I didn't realize it was because my mother was a woman, that she suffered inside her own body and mind starting at the age of 29. I now know it's preventable. You can't unlearn something. So let's make the investment in learning as much as we can about why women's bodies are different. We make up half of the world's population. We are held back as women for so many other reasons. However, this one is curable. Thank you.